So in this video, we're going to focus on diffusion because diffusion is such a key component of the function of the respiratory system. So with that, we've got these 4 outcomes that we're going to talk about. Okay, so we need to recall what the gradients are when it comes to oxygen and CO2 in different parts of the bloodstream. Okay, and so for this video, for right now, we're going to focus on the difference between venous and alveolar oxygen and carbon dioxide. Just a quick reminder, V is for venous, big A equals alveolar. There are places where you're going to see little a, that means arterial. Okay, but for this, we're talking about alveolar. Now, I also want to be clear here that when we talk about blood entering into the pulmonary capillary, it's actually coming from a pulmonary artery. Okay, but we consider this venous blood because it has low oxygen. So as you can see, blood that enters into the alveoli has a partial pressure of about 40. Okay, but when it leaves that alveoli, and really it's leaving the pulmonary capillary, it's going to have a much higher partial pressure. And that's because the alveolus has a partial pressure of about 104. So we've got a big gradient that's driving oxygen from the alveoli into the bloodstream. Okay, and we'll get into specific values in the arteries in the next video. If we do the same thing for carbon dioxide is about 45 in the venous blood, okay? And the alveoli has a partial pressure of about 40 when it comes to carbon dioxide. So as a result, carbon dioxide will go from the bloodstream into the alveoli where we can breathe it out. Just a quick reminder that blood entering the pulmonary capillaries has low oxygen and high carbon dioxide. So why does it leave the alveoli? It's all about, or why does oxygen leave the alveoli but carbon dioxide enters? It's all about gradients. We've talked about gradients a lot through this semester, and it continues to be something that we will talk about. But this pressure gradient drives the direction of these gases. So since there's more oxygen in the alveoli than venous blood, oxygen will leave the alveoli. Since there's more carbon dioxide in venous blood than the alveoli, it leaves the bloodstream and enters the alveoli. Movement occurs via diffusion. This is not active transport. Okay, and that's a good thing because active transport requires energy. So if we had to use a lot of energy to get oxygen into the bloodstream or carbon dioxide out, that would just make life a little bit more difficult. So there are several different things that can affect the rate of diffusion, and we refer to this through something called Fick's law of diffusion. So specifically, pressure gradient, larger gradient, more diffusion. Surface area, so more areas or locations that diffusion can occur, you're going to have greater diffusion. Thickness, so think of this in terms of distance. Okay, it's a lot, you can go a shorter distance faster than you can go a longer distance. That's always true. Okay, so as thickness or distance increases, diffusion will go down. And then you've got a diffusion constant. So each gas will have a specific constant. Okay, carbon dioxide has a higher constant than oxygen. As a result, if all other things are equal, carbon dioxide will actually diffuse more quickly or have a higher rate than oxygen will. Carbon dioxide really likes water, oxygen not so much. Okay, so like I said, Fick's law of diffusion, here it is. You will never use this to calculate, but this shows you in mathematical form what we just talked about. Okay, so surface area, diffusion, the diffusion constant, and the pressure gradient are all in the numerator. So if those go up, the rate of diffusion goes up. However, thickness, it's in the denominator, so if that goes up, the rate of diffusion goes down. So for oxygen, we look at surface area times the diffusion constant of oxygen times the pressure gradient of oxygen divided by the thickness. And that will give us the rate at which oxygen will diffuse. You can do the same thing for carbon dioxide or any other gas. So when it comes down to it, there are 3 primary factors that affect the amount of oxygen and carbon dioxide in your alveoli. See that big A there, that big subscript A. So the first is, what's the pressure of oxygen and carbon dioxide in the air that you're breathing in? Okay, if you have more air or more oxygen or more CO2, that's going to lead to more oxygen or more CO2 in your alveoli. The rate of alveolar ventilation, so how much air are you getting in and out of your alveoli? Okay, when you breathe in, you're bringing more oxygen in. When you breathe out, you're getting more CO2 out. So if you increase the rate of ventilation, you're going to bring more oxygen in, get rid of more CO2. So one will go up and one will go down. And then finally, how much oxygen are you using and how much CO2 are you producing? If you're using a lot of oxygen, your alveolar oxygen will go down. If you're producing a lot of carbon dioxide, your alveolar carbon dioxide will go up. Okay? So, just a quick recap of what I said. So if we increase or decrease the carbon dioxide or CO2, that's going to increase or decrease the alveolar oxygen carbon dioxide. If you increase alveolar ventilation, you're going to increase alveolar oxygen while decreasing alveolar CO2. If you increase your oxygen consumption, you're going to decrease your alveolar oxygen. If you increase your carbon dioxide production, you're going to increase your alveolar carbon dioxide. So let's talk about a specific situation. Let's say you go to Everest or go climb a mountain. Okay. Now on an exam or on a quiz question, I might ask you about, well, hey, what happens if you go to altitude? How will it affect this specific category? I'm not going to ask you what the net effect is because it gets a little complicated. Okay, and it depends on a lot of factors. But let's talk about each of these individually. So if you go up in altitude, how is that going to affect the amount of oxygen and carbon dioxide in your inspired air? And how will that affect your alveolar oxygen CO2? Well, when you go up in altitude, there will be less oxygen, but essentially carbon dioxide is going to remain constant. And this is because, if you recall from when we're talking about partial pressures, there's essentially no carbon dioxide in the air that you breathe in. Okay, so we rounded that to 0. And so if you're already at 0, going up in altitude where there's less air, you can't have less than 0. So as a result, just going up in altitude will decrease your alveolar oxygen, but it's not going to have any real effect on alveolar carbon dioxide. Next, we've got rate of alveolar ventilation. When you go up in altitude, you're going to start breathing more because there's less oxygen. As a result, you're going to try and increase the amount of oxygen in your alveoli, but it's also going to decrease your carbon dioxide. Okay? Now, if you go up in altitude, your oxygen consumption and your carbon dioxide production really won't change. If I'm just standing here in Bloomington and then I go and I magically, beam me up Scotty on the top of Mount Everest, for the most part, the amount of oxygen that I need and the amount of CO2 that I produce will remain constant. Okay? And so as a result, I'll have, based on this one fact, my alveolar oxygen and my alveolar carbon dioxide will remain constant. So, again, not something I'd ask you on an exam, but what's the net effect? Odds are when you go up in altitude, you will have constant or reduced alveolar oxygen, but you'll have reduced alveolar carbon dioxide because you're breathing more. So this leads us to cellular respiration. Okay, remember, cellular respiration is how we produce ATP. And so when we produce ATP, we're using more oxygen, but we're also producing more CO2. And so inside the cell, we'll actually have low oxygen and high CO2. Okay, and so as a result, we've got bigger gradients. And so this will make it easier for oxygen to enter the cell, easier for carbon dioxide to exit the cell. Okay, and so as a result, there's lower oxygen in the bloodstream, higher CO2 in the bloodstream. But the nice thing is this is all going on the venous side of things, so it's not a big deal. We'll get it back to the lungs and everything will be back to normal, assuming everything is normal. So what happens if you have low oxygen or high carbon dioxide? Well, you've got your systemic arterioles. And so these are the arterioles that link up with the capillaries in your tissues. If you have low oxygen and or high carbon dioxide in your systemic arterioles, they're going to vasodilate because you're trying to increase blood flow to get more oxygen in and to get rid of that carbon dioxide. In your lungs, so your airways, specifically your bronchioles, they will also dilate if you have low oxygen or high carbon dioxide to try and get more air in and out. But this is where things get a little funny. Your pulmonary arterioles, so those are the arterioles leading to the pulmonary capillaries where we pick up oxygen and get rid of CO2. If there is an area in the lungs that has, so these pulmonary capillaries, if they've got low oxygen, those pulmonary arterioles will vasoconstrict. And the reason being is that we don't want blood flow to go to an area inside the lungs where there's low oxygen. We want to send that blood to where there's high oxygen so it can pick it up. And we'll talk about that more with the ventilation perfusion video. And so really cause and effect. Okay, low oxygen causes vasodilation of the systemic arterioles. It causes bronchodilation of the bronchioles. However, if you've got an alveolus that has low oxygen, that's going to cause the pulmonary arteriole to vasoconstrict. So finally, just to show a table that kind of talks about what we just showed. Okay, if I have high CO2, that's going to cause the bronchioles to dilate as well as the systemic arterioles. But the opposite is going to happen with the pulmonary arterioles. Now, just to reiterate, when we're talking about the pulmonary arterioles, I'm talking about they're affected by the amount of oxygen in the alveoli that they link up with. Okay, and then the opposite is true if we've got high CO2 and low CO2. So at the end of this video, can you list the partial pressures of oxygen and carbon dioxide in the veins and alveoli? Can you identify the 4 factors that affect diffusion and describe their effect on diffusion? Can you identify the 3 factors that determine alveolar oxygen and carbon dioxide? And can you explain what happens to systemic arterioles, pulmonary arterioles, and bronchioles when we have changes in oxygen or carbon dioxide?